I'm going to talk to you about fluid advice, so fluids that are good to drink and fluids to avoid that usually irritate your bladder.
Normally it's caffeine. Caffeine is a big bladder irritant, and things that contain caffeine are typically tea, coffee and drinking chocolate actually as well. You can have a decaffeinated alternative, but avoid drinking too much of them. If you're drinking about 10 cups a day, that is probably too many, even if it's decaf coffee. So certainly caffeine is a big no-no to the bladder.
Other fluids that we tend to find kind of like irritate the bladder, anything fizzy, so it's what they put in it to make it fizzy, so the carbonate, that can irritate the bladder in the same way that sweeteners can irritate the bladder as well. So basically what's happening is those artificial substances are going into the bladder, they're irritating the bladder lining, and the bladder's going, I don't want this in here anymore, let's get rid. So it overstimulates and the bladder contracts and makes you want to go to the toilet even quicker than what you normally would do.
So avoid caffeine and things that irritate the bladder. We do have an information little leaflet that we can give you, and it clearly describes there what you can drink and what you can't drink. Avoid over drinking. A lot of people drink loads and loads of fluids thinking that they're being healthy, and sometimes it's the worst thing you can do because it causes a lot of frequency and urgency. So just make sure that you're drinking enough fluids to maintain good bladder health, but not over drinking. A good way of finding out what it is you're actually drinking is to get you to fill in a chart, and you may be given one of these when you come to clinic. It's typically a 3-day diary that records every time you go to the toilet, how much you pass, how much you empty your bladder, and also how much you drink, and it asks about leakage and bladder sensation. So it's a good indicator for us, isn't it?
It gives us a lot of information, doesn't it, about how the bladder's working. Is there something that's irritating the bladder? Are you drinking too much? Are you not drinking enough? Are there any links, and we can use this as a really good tool to kind of like really narrow down what's going on with your bladder a little bit more.
They are onerous to fill in, but they are over 3 days, and you can use any 3 days you like. They don't have to be consecutive, but they do provide us with an awful lot of information. So we always ask for the chart. So please have a go at filling it in.
Are there any tips that you can think of that might indicate or give you an idea if you're drinking too much or too little?
Usually by looking at the colour of the urine. So it should be a pale yellow colour. So if it's quite dark and orangey, that indicates that somebody's not drinking enough.
Yep.
If it's like water, then they're over drinking. So normal coloured urine should be a pale yellow straw coloured.